you operate, as you mentioned, in a number of end markets, seeing strength really, it looks like across the board, construction being one of those key.
Was originally supposed to be here this morning, but unfortunately, she had to take care of some other personal business that came up, and she could not be here. But also, who is on online also is Mr. Darian Williams out of Baton Rouge or Zachary, Louisiana. He is part of our training team, and then I'm going to introduce also Mr. L. Drake Smith that we're going to bring on from the Houston area to also do COVID training for our organization. The D-South Center for Environmental Justice is a reentry or environmental training organization and a public policy organization for climate change and for environmental justice. We've been around for 27 years now, and our director is the great Dr. Beverly Bates Wright, who now sits on the executive board for climate change for the Biden administration, among other things. She is known in circles as the mother of environmental justice and climate change, along with Dr. Robert Bullitt, who is a emeritus professor over at TSU, Texas Southern University in Houston. And our guys that we've been for over a year now, uh, been doing virtual training when it comes to COVID issues, and things are changing rapidly every day. I don't know about you guys, but our governor here in Louisiana just rescinded the mask mandate for certain private entities or businesses, and now we're kind of like in a hybrid. Some places are mandated, some places are not. Schools are still mandated. Healthcare facilities are still mandated, and public transportation, but they're leaving it up to private businesses to open or not. And I always been using this for the last 6, 7 months when we've been seeing different things, people doing things like the pandemic is over with. I say open does not mean over, and we have to really think about this, and because we're about to make the same mistakes that they did back in 1918 when people got tired of doing those things that would protect people. And unfortunately, just like the flu, and a lot of people didn't know, and I think Miss Michelle may bring up some statistics, but before we had COVID, we had approximately 30, maybe up to 45,000 people die every year from the flu, and over 4 million people hospitalized because of the flu. And we just started just accepting the numbers. And now we're getting to the point where we're tired of the COVID, and we're just starting to accept the numbers. And unfortunately, you ask most people about recovery and those things, they say yes, but or you want to be part of that 5, 6, 7% that will die because you don't want to do the right thing. And that's what I tell people all the time. You have that personal choice, but your personal choices should not endanger me publicly. So with that, I'm going to hand it over to Ms. Michelle. I'm going to be monitoring. Mr. Darren is going to be monitoring also. We're going to be monitoring the chat. So if you have questions, please put them into the chat, and we'll try to answer them. Ms. Michelle.
Thank you so much, Bruce. I'm trying to see my slide presentation. So this is Kim's information. I'm going to move on. So I'm Michelle Dawkins, and I am the chairperson of the Education and Workforce Development Committee here at the Atlanta Black Chamber. And I just thought that, it just made sense since we're currently doing the trainings with the Deep South Center for Environmental Justice to bring this as one of the things that we talked about with the ABC, because we have to understand that even as small businesses, we still have obligations. We have many legal obligations. We have some things that, we have to understand as far as people that come into our facilities, whether they're workers or whether they're our clients. So just a little bit of background about myself. I've been training for over 25 years in this particular realm in occupational safety and health for about 15 years now. I've been collaborating with Deep South Center for a number of years when I worked at Clark Atlanta, actually under Dr. Robert Bullard. I was at Clark Atlanta for 10 years in the Environmental Justice Resource Center. And that's what really gave me the passion that I have for working with our community and working on issues such as COVID-19. We do disaster preparedness. I've been doing a lot of workplace safety and health, but my specialty has been hazardous materials and hazardous waste handling for a number of years. I do a lot of corporations, military installations, and automotive industry. I've been doing those actually around the country now for at least about 15 years with the corporate area, because my focus really has been community. So I'm getting more involved, back involved with the community. I'm also a member of the Clayton County Community Emergency Response Team, known as CERT, and started my career years ago as a microbiologist. So that's just a little background on myself. And we're just gonna get right into the heat of this thing. Information on COVID is rapidly changing, sometimes daily. Business owners should be monitoring both all of the federal, state, and local public health mandates that are coming out as it relates to the regulation and guidance. And as a matter of fact, just this week, I was reading where next week, I believe it's going to be next week, that the president is actually going to be putting out some more directives that are really going to be geared toward businesses. The businesses have to understand that they have to have written plans in place. So as they're reopening, as Bruce has already indicated, you are still responsible for anyone who walks through your doors if you have a brick and mortar, or even as you're going out. A lot of this information is applicable because you are still visiting restaurants, hotels. If you're going to be traveling, you need to know what the rules and regulations are. You know, God forbid you get to another country because you're traveling and you're not able to get back into the United States, or you have to stay over there, because I do know some people recently who went to Puerto Rico and they were confined to their hotel room at their expense. They could not go out of the room. Their key was taken away and they had to order room service, and all of that was at their own expense. So you have to really know what the rules and regulations are, even for things like travel, like I said. Okay, I'm having a problem moving this thing out. I apologize, a technical glitch here. I need to use this little thing to get out of mine. Okay. So our goal today is to help increase your awareness as it relates to potential exposures and transmission of COVID. We are going to be helping the small business understand your role and your responsibilities. Also, you need to know what you should do initially. As these businesses reopen, it is your responsibility to do a risk assessment. You need to actually know what the risks are in your business, be able to define what protective measures you'll use, and make sure you're using the correct protective measures. Because I've gone into some companies and they have their people wearing respirators and not masks. Well, there are some mandates that go with wearing a respirator versus a mask. You have to have medical clearance, because God forbid that person has some kind of a medical emergency, because you mandated that they wear a respirator and you did not have that medical clearance for them to do so. So things like that can really get you caught up. Also, you need to have an understanding what the rights are as far as safety, as far as your workers or any employees that you have, any volunteers that you have, because this is also applicable to our nonprofit organizations. That if you have people that are volunteering with your organization, you need to know what to do for them as well. And then also know what strategies that you need to have in terms of mental health for the workers that you're working with. Because one of the things that we are seeing is an increase in mental health issues. And so we'll talk about what that translates. We've already seen that in our country. We're seeing more violence in the workplace. And it's only going to escalate as all of these businesses open up and people are not taking into consideration the mental anguish, the mental stress that some people have been under during this year and a half almost of being at home or being confined. And so those things translate into workplace violence. And so we need to have plans on, what to do around that as well. So one of the things that I really try to impress upon people, because I have this argument all the time, is that, well, we got things together, we don't have to do anything. There is what OSHA calls a general duty clause. That's almost like a gray area in a contract. It may not specifically say what you have to do, but if a person goes in, they have, or a person is working for you, they have a right to work in a safe and healthy environment. That is a part of OSHA's general duty clause. They have the right to work in a safe and healthy workplace, free of recognized hazards. And right now, we know that COVID is not recognizable, but you have to still go through all of the steps to make sure that, you have that covered. And later on, Miss Jennifer Balbosa is going to come in and she's going to really hone in on, the cleaning processes, also, what her company does to help other businesses make sure that they're using the appropriate cleaners, because that's another area that companies are getting written up for, because they're using anything and everything. I hear of so many people just pulling out that bleach, and you have to understand there's some really, really serious guidelines when you start using inappropriate products, or that you're using products and you're using them inappropriately. So we're going to have Miss Jennifer talk about that in a little while as well. So making sure that you are able to identify and assess the potential risks that your company has as it relates to opening up. These should be a part of your COVID-19 preparedness plans. And all businesses are required to have what we call a COVID-19 preparedness plan. It should be a part of your HASP, your health and safety plan. If you do not have a written health and safety plan, then you are pretty much in violation already. We're seeing the need more now because we're talking about something that falls under our infectious disease control. And so we want to make sure that you are taking the necessary steps, even, to the point where you have something in writing. Because remember, anytime someone gets, there's any complaint about your business, a person comes out, an OSHA person comes out, investigator comes out, they want to see what you have in writing. That's going to tell them whether or not you have a plan in place. Can't just be in your head. So you want to make sure you have all of the preventive measures along with some kind of continuous monitoring process or practice in place. You should also have a plan for implementing continuity. What does that look like? We saw that in the very beginning. Most businesses were having difficulty because they had no business continuity plan. This wasn't something that we planned for, of course, but we have all kinds of things happening now. In addition to the pandemic, we have some natural disasters. We're having floods and different storms. And we want to make sure that you have a written business continuity plan in place and be able to, bounce back after any kind of situation like the one we're incurring right now. So some of the other areas that should be a part of your workplace plan. Did you guys lose that? No. You should actively encourage sick employees to stay home. You should be doing daily screening. And what does that look like for your business? Is it just the fact that you're taking temperatures? What other mechanisms do you have in place for screening your people, that are coming in? Identify where and how your employees who might be exposed to other individuals, identify, what you're going to do with them. What happens if you have somebody who comes in sick? There are some guidelines as far as, you can't just start firing people. OSHA's really honing down on the processes that businesses are taking when it comes to how they're handling their workers. So you really want to be very, very careful. Take action if an employee is suspected or confirmed to have COVID-19. What does your individual plan look like if you know that somebody comes in, but they feel like they have to go to work? Because remember, some people have been out of work for a long time. So, they're going to come to work. What is your contingency plan for that? And then are you educating employees on how to protect themselves, both at work and at home? Because if they're not protecting themselves at home, then they're going to bring that into the workplace. So those are some of the things that you have to be cognizant of. Sometimes my slides are moving, sometimes they're not. So be informed and prepared. Make sure that people are still practicing the 6 feet distance. Wash your hands frequently. use your alcohol-based hand sanitizer, but water and soap are better. So I tell people, if you're at home, why are you using hand sanitizer? The best way to actually sanitize your hands is by using soap and water. It's been known that soap and water kills kills any kind of bacteria or virus quicker than using the sanitizer. Plus, the sanitizer actually breaks down your skin. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you're sick. Cough and sneeze, all of the things that we know we've been talking about, but now they're coming out and they're saying, well, you don't have to wear masks. So what does that mean to people? That means I don't have to wash my hands either, right? That means I no longer have to clean off areas. And that's where we're going. When you start breaking down the system that's already in place, then people are going to become very, very lackadaisical with the other areas as well. You do want to continue to clean and disinfect frequently, even though I just heard, I think the CDC say that you don't have to do it anymore. Think about it, even with influenza and regular cold and flu, those are the areas where most of the time you're having the transmission. So don't stop doing things that are obviously known to help in other situations. And I won't go through all of these, but these are some of the things that, we've already talked about: using cough etiquette, wipe down those surfaces. And this is for you, even as you're going out in public. Continue to stay diligent, make sure that you're doing what you need to do. And now they're saying that people who have been vaccinated don't have to wear a mask anymore. Well, what do you think that's going to do to the general population? Because there's no sign on my head that says I've been vaccinated. So there's going to be people taking off their masks who actually have not been vaccinated. So that's going to increase the potential for the spread of this disease. And as Bruce said earlier, in 1918, when they thought that the thing was over, believe me, that second wave came in and killed more people than the first wave because people became very complacent. So your business, your risk assessment should include, do you have a process? Or the questions you should ask yourself, do I have a process in place already? Do I have any kind of a safety team that's addressing that? And that team may just be you. Whatever it is that you have to do, make sure that you have a written process in place. And then what methods can you employ? You need to do actually what we call a job hazard analysis. You need to actually go in and see every point where you have face-to-face contact with someone and make sure that there's no breaches in that system where someone can actually become infected. And then how will you document your assessments? You have to keep the paperwork. Do you have a sign-in sheet for people who are coming in and documenting the time that they came in? Because if I come into your facility, it's tax time. I come into your facility and I'm there for an hour and a half getting my taxes done, and I'm touching stuff and I'm doing all of that, and I go home and I get sick. I may come back and say, I think I contracted it from your facility. And you're like, well, what time were you there? You have absolutely no record to document when I was there. So these are the things that when we talk about, do you have a plan in place? So these are some of the ways you can do it. It should always be in writing. Take photos if feasible. Take photos of the areas that you've already, you've cleaned. Your documentation, your information should be widely available to all of your employees. Can you mute your line, please?
Michelle, unmute Michelle.
Okay, thank you. And you should be able to describe the time and place and the method of the assessments that you utilized as well. Some other questions that should be asked: do specific job duties require closer, repeated, or extended time with people that may be known or suspected to have COVID-19? What are your workers doing? What is that frontline worker doing? Are they, speaking to people? Do they have the partitions? What does that look like? And then that's how you make your assessment. Does the job task require close contact? Are you going to be less than that 6 feet away from your public? Then if so, you are mandated by law to provide your workers with the necessary PPEs. And then, has the community spread of virus increased the risk of workplace exposure? I can tell you one thing, it's summertime. People have been locked in, locked up for a long time. They just want to get out. That's what they want to do. So they're going back out to the restaurants. They're back to, commingling with everyone. You have to make sure that you're keeping your safe place for your people. And one of the things you have to do, this is what we call the hierarchy of controls. And we don't work from the bottom up, although initially with our last administration, this is to me what caused some of the greatest breaches. And I think this is why our numbers were so high, because we started from the bottom up instead of the top down. You need to work on the elimination, removing the actual physical hazard. In some instances, that means keeping that sick person at home, having them stay at home, having them telecommute. Then substitution. We're going to get into some of these in a couple of slides, but substitution, that may mean having, your barriers in place. Engineering controls, isolating the people from the hazards. That's that 6-foot distance, setting up tables or your workspaces so people aren't very close to each other. Some of the other administrative controls that you may come up with. And then the last line of defense is always your PPE. It's not first, it's the last line. And then that's where a lot of times we see the breaches with the systems that we had in place when we initially started all of this back in March of last year. And Bruce and Darian, feel free to jump in at any time. So using the results of the hazard analysis, that's when you're going to determine the exposure, whether it's high, medium, or low. For your business, some businesses, they have a high potential because they're dealing with customers on a regular basis. And those customers are up close and personal. So what are you doing for that high volume or that high potential, of risk? You have to have something in place. And then you select the necessary control measures using that hierarchy of controls that I just showed you, and then be able to evaluate and make the necessary adjustments as you go along, because as right now people are trickling in, but next week, you may get, a burst of population of people coming in. So now you're going to have to adjust for that. And what does that adjustment look like? Make sure you're documenting that along the way. So these are just some examples of your controls, your 6 feet workstations. And a lot of companies are, even though the government is being lackadaisical and saying that we can go back to business as normal, a lot of companies are saying, you know what, we're still going to only, allow so many people into our facility. We're going to still keep our barriers up. We're going to still mandate that you're wearing masks, because remember, the government are giving us minimum. They're telling us the minimum criteria. You can always go above that. And actually during this time you should. And like I said, history does repeat itself. All you got to do is do the research and look at what happened in 1918, and you'll see that we're right where they were before, the catastrophe happened, with an increase of people actually dying, not just getting sick, but dying. Increase the general ventilation. This is the time where a lot of businesses, now that it's getting hotter, are turning on your HVAC systems. Have those systems been cleaned? What does that, have you changed out the filters? What does that even look like as you're bringing in people now to a business that's been closed up for a long period of time? Are you using electronic prepayments of goods and services so that you're not doing a lot of that hand-to-hand handling of cash? These are pretty much the same thing: ventilation, drive-through services, plastic shields and other barriers. We're seeing that in a lot of the governmental facilities that you go into. Sneeze guards. All of these are some of the additional engineering controls that need to be put in place if you're talking about reopening your business. And then you should be looking at this when you're visiting businesses as well, because this is twofold. Some choke points. Those are areas where you have to have concentrated areas where people come into contact. If you have elevators in your facility, what does that look like? You don't want that stream of people coming into those elevators just because they're saying that everything is okay and people are now vaccinated. You may be on that elevator with that one person who's asymptomatic, and they're walking around with it, and now you're confined in that closed space. So you don't let your guards down, is what I'm trying to say. So some of the choke points will be hallways, elevators, break areas, buses, and other forms of transportation. Those are some of the things you have to be aware of. As far as administrative controls, you need to have a written exposure control program. I'm going to continue to stress written because I don't know how many businesses I've gone in to do assessments, and I can tell a lot about a business by their documentation. And most of the time, lack thereof. Most of the time, they don't have the necessary documentation, and then that's what gets them in trouble. The number of customers allowed to enter, is that still going to be limited for you? What does that look like? Some companies had to resort to changing their hours of operation. You could have peak times and then you have some other times. What does that look like for your business? Are you going to have staggered, people coming in on a staggered basis? For restaurants, many of them have switched to the takeout and delivery only, and some of them are continuing to do that. Just because I don't think, people feel that comfortable with going back and sitting into that in that dining area. And one of the reasons I say that also is if you've been out anytime, and I've had to travel as of late, the hotels are understaffed, the restaurants are understaffed. And so what does that what does that mean to me? That means that you're having to skip steps. Because if you don't have all of the staff in place, I know that you're not doing everything that you're supposed to be doing, because that means one or two people's doing a little bit more. And so what does that look like? And then discontinuing of non-essential travel. Well, some of the time for what we do, we have to travel because the businesses that we go into are in other places. And so now we're having to deal with hotels and restaurants and all of those things to keep us going while we're doing the work that we do and training people on how to do, how to keep themselves safe. So we're sometimes placing ourselves at risk, but because we know what to look for, we go in with a different eye. And I tell people that all the time. When we go into hotels or anything like that, we go in with a different eye. Limiting the number of staff present for high potential exposure areas. Those are some of the administrative controls that you can put in place for your own business. And these are some of the things that you need to be talking about, with your team, whoever your team is. And then training. Making sure that whatever you do, you train those people that are around you so that they are familiar with the protocols that you are now implementing. And that's one of the things that they look for as well. You have to make sure you're training your people. So these are some of the precautions as far as visitors that are going into your facilities. Have your own rules. If they're sick, don't let, have a policy where they're not allowed to come in. And this, of course, this one was dealing with a clinic, but the same thing may be true for your facility. If you see somebody that comes in, now you have to be able to, it's kind of difficult because now we're in allergy season, and people who have allergies, they already kind of feel some kind of way because if you sneeze, everybody's looking at you. But you want to be able to have some kind of a system where you are at least monitoring the people who are coming into your facility. Some other things, a lot of people are using the temperature checks. Well, it's getting hotter. So what does that mean? I just ran across the parking lot. Yeah, my temperature is going to be elevated anyway. Does that mean that I now have COVID when you check my temperature when I walk into your facility? Those are some of the questions you have to ask yourself. So some companies are still allowing workers to telecommute. They're using phone, email, and all of those things, readily because they still want to make sure. And I think we're going to probably be in this mode for a while. But like I said, there's some new directives coming out just next week. This current administration has said that they're going to be honing in now on workplaces, and some of the directives are going to be geared directly towards that. So what about sick leave? What are your sick leave policies? You have to, once again, ensure that your policies are flexible and consistent with your local public health departments. You need to make sure that all of your employees are aware of it. You can permit your employees to stay home to care for sick family members or for their children, and give guidance on future sick leave, because there are some governing rules now regarding the sick leave and what you can and cannot do. There are some companies that are right now in litigation because they were just telling people, firing people. They were doing all kinds of things because they weren't taking heed to what the CDC and your local other state and local agencies are saying in terms of people being sick. You cannot treat it the way you used to with your regular sick leave during this particular pandemic. You cannot have punitive damages. In other words, this is what this particular slide is talking about. If you don't offer sick leave to employees, you should have some kind of non-punitive emergency sick leave policy in place to cover your employees. You cannot penalize them. And this is where, like I said, a lot of the legal stuff is coming into play, because workers are going back and saying, well, you know, I got fired because I had COVID and they didn't have, you know, whatever plans in place. You have to have a plan in place. Your COVID-19 plan should dictate what all of that looks like. And if you tell your workers to stay home, there should be no kind of reprisal as far as loss of pay and benefits and things like that. So you got to make sure that, you know, if you have to speak with your legal advisor, you know, you want to make sure that you're covered in those areas, because that thing can come back to bite you. So OSHA's really, like I said, they're doing a lot of things. They're recognizing all of the challenges that companies are having, but standards still stand true. The workplace standards that were in place before COVID are still relevant today. And so companies are kind of doing their own thing, and many of them now are getting cited. And the citations are, you know, OSHA increased their violation fines, what, about 4 years ago, Bruce, something like that? 4 or 5 years ago. And so now the cost, it may cost you now for the things that you're doing if you're not following the proper guidelines that you need to be following.
I think Michelle said it earlier, that every employer, most people think that they have to have 100, 200, 300 employees to follow OSHA regulations. OSHA says that if you have one employee, you fall under OSHA guidance and regulations. And you talked about the general duty clause. You have a general duty to make sure that your workplace is reasonably safe and risk-free, and that including infectious diseases. And what we're cognizant of the COVID, but they have to be very aware of that. We have been having outbreaks of measles. Tuberculosis have not gone away. And the reason for this is because you have anti-vaccinators. These people don't believe in vaccinating anyone or their children. So you may have those people working for you or working around you. So you not only have to think about coronavirus, but you just have to think about any type of infectious disease where we thought they were eradicated, but they are making a comeback because people refuse to take vaccinations. Just want to bring that out, Michelle. Thank you.
Okay. So OSHA's requirements for preventing occupational SARS-CoV-2. Remember, SARS-CoV-2 is the actual virus that causes COVID-19. The OSHA general duty clause that Bruce just quoted again, that is still in existence. There's some personal protective standards or laws, regulations that have to be abided by. Like I just mentioned, it depends on whether you are required to have your workers wear a mask versus a respirator. The bloodborne pathogen standard still is in existence, and is something that if you have to deal with any kind of blood in your facility, that your workers need to be aware of, you as an employer need to be aware of. Record keeping requirements during COVID-19. All of these things are what OSHA will look into if they get a call that, you know, there's been some kind of a breach or someone's gotten sick, or, you know, they feel like they've contracted the virus through at your particular business, your place of business. So these are some of the things that, you know, you would rely on someone like Bruce, myself, Darian. These are the kinds of things that we go in and educate companies on. These are just some of the laws that are not, like I said, that are not suspended. All of these fall under these categories. Now, the Families First coronavirus, I know that they were talking about it expiring, and I did not go back and double check to see if they extended it, but this was put into place to cover the workers. And Bruce, I don't know, you may be able to chime in because I did not go back and see whether or not they had extended it. I know they had talked about it. And like I said, these things are changing so rapidly. I'm not sure if this administration went ahead and said that they were going to extend it beyond December.
You have to look at your state's workman comp department or division, because there's different aspects of the CARES Act that came out, and what the Biden administration has pushed forward and also wrote into executive order. So every state is just a little different. So it's best to get in touch with your state Department of Health and Human Services or your workman comp, and then they can give you more information.
Thank you, Bruce. And then also, he mentioned a good point. Also, we have some states that have their own OSHA, and Georgia's not one of them. And so you want to make sure, once again, that you check your state laws to make sure that you are in alignment with what they're mandated as far as sick leave, family medical leave, and things like that. So cleaning and disinfecting. I'm going to talk a little bit about this, and then I'm going to go back up and let Jennifer step in. Jennifer has a cleaning company, and she can talk about some of the things that she's doing. So making sure that you clean your workplaces often. Understand that cleaning and disinfecting is two totally different things. A lot of companies are just cleaning and they're not disinfecting, or they're not disinfecting in an appropriate manner. So employers have to be, business owners or employers should be the ones that develop site-specific procedures for cleaning. Make sure that you are using products that are listed on EPA's list. And I have the website there, but you can just Google EPA list N as in Nancy, and it's going to tell you the products that are designed to kill the COVID-19 virus, because all cleaners are not the same. And so you want to use something that is appropriate, and then also something that does not cause a toxic effect, because that's another issue that we're seeing, is that people are using any and everything. Like I said, people start pulling out that bleach, and I've walked into facilities where the bleach smell is overwhelming. Well, if I have any kind of compromised health situations, then that can actually cause me to pass out. It can, if I had asthma, it can be a trigger for my asthma. You really want to be careful with how you're disinfecting, especially when you have the public coming in, because that can be a guideline for really, harming somebody. So you want to make sure that you are disinfecting appropriately, using the proper chemicals to do so. So we have that list of the products. You want to make sure that you're abiding by the contact time. Contact time means that if I spray a particular product on a surface, then I don't immediately go and dry it off. There's what we call a kill time for that product. You want to make sure it actually stays on that desk or that surface for that designated amount of time for it to actually be efficient and kill that particular virus. So once again, you just want to make sure that you are using the proper products, and that you are disinfecting and abiding by the expiration dates. Because when you don't, these are some of the issues that you can have. Workers can actually come down with skin rashes or dermatitis, the person using it. You could be using the wrong type of glove. They could be using the wrong type of gloves. It can cause irritation to the nose, eyes, or anything like that. Or worse, individuals can come up with what we call occupational asthma. That means that they've been subjected to some kind of a chemical like the sodium hypochlorite or any of the others that are listed here, and it now causes me to have asthma as a result of my exposure to these chemicals. So you really want to be very, very careful in what you are using, to sanitize your facilities. Make sure that, you are following the guidelines, the manufacturer's guidelines on there, and that you're doing what you need to do. The product labels, using the proper gloves. Make sure you're not giving people latex-based gloves, because if they go into anaphylactic shock, then once again, there's all kind of issues. And this is why, this is so important that you understand exactly what it is that you're doing. And so we have a hazard communication standard, which means that a worker has a right to know what chemicals are being used in the workplace. When people start pulling out stuff, especially when I'm traveling and all that, the first thing I ask is, what is that you're using? And most of the time, I've been told, I don't know. I was in a T-Mobile store recently, and the guy a contractor came in and just started spraying all the tables. And I asked him, what are you using? He's like, I don't know. He didn't have any labels. I said, do you know that's illegal? You know, I got all in his business, but I just wanted to know because I'm in public. You don't know what my health situation is like. And that's why I said it's not just, you know, if you're a business owner, it's because we are the public and we go into these facilities and we think that because people have jobs or whatever they're doing, they know what they're doing. And oftentimes they don't. He went into telling me how much he makes, you know, how much he gets for going from T-Mobile store to T-Mobile. And I'm like, they didn't even vet this guy. He doesn't even know what he's using, you know. And anytime you work with chemicals, you need to know what that product is. Is it harmful? You need to be familiar with a safety data sheet, you know, all of those kind of things. They need to be labeled. All of these things need to be a part of what it is that you're putting out there, you know, especially when you're exposing other people. So I'm going to deflect for a moment. Jennifer, you can jump in right here.
Thank you, Michelle.
You're welcome.
If it's possible, Michelle, if you can give me access to share my screen, I have a few things that I'd like to share with the audience.
Okay, sure.
Just for clarity, International Supply Partners, we are a supply and equipment company. We offer medical office and janitorial supplies. And obviously, as you can imagine, during this pandemic, most of our business has come in supplying PPE and cleaning equipment as well as solutions. You know, being a mother, I have 2 children who have asthma. My daughter also, and a daughter who has diabetes. So as you can imagine, the level of concern and precautions that I have to take in what I expose my children, even pre-pandemic, is important. So coming from a background of cleaning services, my father's owned a cleaning service for over 40 years at this point now. I'm very familiar with the different chemicals and solutions. And what I tell my clients oftentimes is you need to be familiar with the end list. You need to be familiar with the different solutions, what type of solution works on what type of surface, who can be exposed, what the kill time is on these solutions, on the surfaces, and also be aware of any health issues or circumstances that your staff may have, and so that you do not compromise them as well. Secondly, in reference to the customers that you have coming in, you want to consider what are you exposing your clients and your customers to, as well as managing how to keep record so that you are not exposing your company to potential lawsuits, fines, and fees that can essentially, especially for businesses who have been really impacted by the pandemic, put you under or put you out because of not following simple processes or protocols.
Jennifer,
So what I'm going to, I'm sorry?
Oh, you're about to share your screens. You have ability to share.
Yes.
Okay.
Yes, I am going to share my screen. Let's see if I can do that. I have a few things that I want to share. Give me 1 second so that I can give you an example of what we have been able to provide for our clients. I think this is it. For our clients during this pandemic, and how you can utilize it to maximize your protecting your business, protecting your staff, as well as protecting your customers. The first thing that I have here, I'm not sure if you guys can see that, if it's it says keep your business safe. Can you see that?
Yes.
Okay, perfect. So this is a solution, a technology solution, International Supply Partners. We consistently are looking for state-of-the-art technology products so that we can extend that to our customers to make sure that they are being as efficient as possible. In reference to keeping record of employees as well as customers that come into your facility. and making sure that you are recording what time they came in, what time they left, temperature checks without having to expose another staff member to forcing them to be in close proximity of customers that may be carrying the virus and then exposing them to that. We have the intelligent face recognition thermometry technology. I have health facilities, hospitals, school systems, as well as other businesses who have taken advantage of these. And I'm sure you've probably seen this at some other facilities, whether it's airports, gyms, a variety of different places. These systems will not only check body temperature with or without a mask, it can identify and alert you of unwanted individuals. For example, I have a church who purchased several of these so that they can identify their staff as well as church members during funerals, because they were the only church in their area that stayed open for funerals, and they were spending about $800 per funeral for up to 4 nurses just to do temperature checks, which as you can imagine can be very, very cost prohibiting. These machines, they purchased several of these so that they can put that in. They were able to utilize this because one of the staff members had a restraining order against an individual, and they want to make sure that their staff member was consistently safe. So they were able to utilize this to make sure that it would identify anyone who should not be in that facility as well. And it keeps a record. It goes into a cloud. So now you have accurate information without having to worry about jotting down on a piece of paper, losing that paper, having multiple people touch a pen, and then now you're exposing everyone who touches that pen or paper, as well as having a picture to identify it. So what is this doing? It's protecting everyone. It's protecting your business in general, protecting you from any legal liabilities. It's protecting your staff from further exposure. It's protecting your customers as well when they come in, so that you can make sure that everyone is safe. Another product that we have shown, oh, I apologize for this. Let me see. Here we go. This is a thermal, personal thermal wand, UV wand. Basically, these UV lights will kill germs up to 99.9%. I have businesses who have purchased one of this for each of their staff in their office. These are good in sterilizing equipment that can otherwise not be exposed to moisture liquid. So if you are cleaning your space and you have electronics that can't be wet and you still need to sterilize it, the UV lights can do that as well. And I carry one in my purse everywhere I go. When I have to go to the grocery store, before I touch that keypad, while they are running my checking in all of my purchases, I'm doing this running the keypad over this with this, because I don't want to have any further exposure. Another product that we've sponsored for multiple businesses is our personal PPE kits. Businesses have offered these to their staff as well as their customers. This further eliminates exposure. You see some businesses where they'll have an open box of masks for individuals to reach in and touch it. Now, as soon as you open that box, it's exposed, it's compromised. And now you are further compromising everyone when multiple hands are reaching into that box to pull out a mask. So that mask now is really absolutely useless, because it could have potentially carrying the virus, and every mask in that box is compromised, and everyone who pulls a mask out of that box or is being handed one by an individual, where you see the some stores where they have an individual at the front with a hand sanitizer pump. Everyone has to touch the hand sanitizer pump. and they're passing out a mask out of an open box, and everyone is just putting on a mask that is potentially exposed to a virus. So it becomes really just absolutely useless. These personal PPE kits come with a set of gloves, hand sanitizer, a mask, and disinfectant wipes. And we can customize these for your businesses as well.
Hey, Jennifer, are you
Yes.
showing those other slides, because we're still stuck on the keep the business safe?
Oh, my apologies. Let me see.
Thank you, Andrea. I was just about to.
Thank you for that.
Mhm.
Let's see if I can get back to that. All right, can you see that?
Yes.
All right, so this is our, like I said, the PPE kits that can be customized. I'm going to go back to the UV wands, UV light wands. This will is good for sterilizing. It's the same grade that hospitals use to sterilize surgical equipments. We also have sterilization boxes. We have sterilizing lights, tree lights that you can put into an office space when no one is there. You don't want to be exposed. You don't want to expose your skin or your eyes to these UV lights, because they can harm you. It can burn your skin, and it can definitely burn your eyes and damage your vision. It's that strong. But these work well for any type of electronics. I use it on my keys, cell phone, when I go out to in public spaces and I'm having to touch certain products or machinery or anything that other people are touching as well. And let's see, what else do we have? And then again, the thermal face detectors. The other products that we offer are all cleaning kits. We offer all equipment from foggers to sprayers, as well as the cleaning solutions. And we customize our services to our customers according to your place of business, who you serve, and as well as what makes most sense. You want cleaning products that do the job without having to harm your customers or staff in the process. And understanding what those are, what those options are, is a service that we continue to offer, because it's not just getting those products to you, but making sure that you understand what they do, what they don't do, what the pros and cons are, and what is going to be the best fit for you and your business. And of course, we want to make sure that our customers, we are mitigating as much exposure to legal and health liabilities at all times.
Thank you so much, Jennifer. And once again, just vital information, because, you know, once again, a lot of times we find out this stuff after the fact, and we can't afford for our businesses to get hit like that. So the cleaning is a very, very big piece of what we're doing. And even though we're getting these different confusing messages from some of the agencies that we've been depending on, you know, our CDC and our local health department, I say don't let down your guard, because right after, you know, this, we start all over with our influenza season again. You know, so you want to make sure that you're staying diligent and that you're on top of what's going on in your facility, in your business. And hopefully we'll have a few minutes at the end to do some questions and answers. So you want to anticipate, what can the business owner do? Anticipate, recognize, assess, or evaluate your area, come up with your control mechanisms, and then comply and make sure that you have a safe environment for all of your workers, your customers, your clients, or whoever it is that you're dealing with. And then lastly, you know, we cannot end this without talking about the mental health, making sure that, you know, you're protecting your mental health, that your workers are being protected, and that they feel comfortable, because, you know, this is a stressful time for not a lot of people. So they do have some, you know, you want to make sure that you're staying connected to family and friends. Like I said, this has been very, very difficult for a lot of people who were out of work, who were out of money, who were out of just everything. So have some stress relief practices that you can deal with, reading, exercise, getting out in the garden, whatever you need to do to be able to exhale, you know, because you can't keep taking all this in and not be able to exhale in a safe space too. Avoid unhealthy behaviors such as excess drinking, alcohol, drugs, any of those things, because of course, once people are doing that and they go back into the workforce, then, you know, into the business, back into work, then we're going to have an onset of additional problems. So make sure that you think and plan out what it looks like as you go forward. Many people have had to make the pivot. You know, we've had to reduce from doing a lot of face-to-face training to doing a lot of remote training now. And now, you know, I've gotten into the groove of it, but I still miss connecting with the people that I'm accustomed to doing trainings with. You know, the population that I deal with, I really kind of miss that. And we're slowly but surely getting back up to that. So some of the things, you know, make sure that you're eating correctly, things that are going to enhance and you know, enhance your metabolism, your immune system. Make sure you're getting adequate sleep, exercise. Make sure you have some kind of a social support network as well. A lot of people aren't that fortunate in that area, but just, you know, getting out and connecting with people again kind of, you know, helps, but making sure that you stay protected in terms of, you know, your mask and those other things, and then relaxing. So we want to just say thank you so much for attending this. We do have a few minutes to do some questions and answers. We have, quite a bit of time. So we have, like I said, we have Bruce, who is over at the Deep South Center for Environmental Justice. We can take a couple of minutes and have Darian. Darian, are you available? Darian is out of one of our colleagues out of Baton Rouge. And if I can see Darian, I can get him to introduce himself and tell us what he's doing out there, because we're all doing this work together.
Michelle?
Yes.
Hello.
So, yeah, just before he introduced, there are some questions in the chat. Are you going to try to address those after this part, or?
Yes. Yes.
Okay. There are some questions in the chat.
Okay, so maybe Darian's not on it right now. So
No, I'm on.
Okay, can you go ahead and introduce yourself?
Hey, well, hello, everyone. My name is Darian Williams. I also work with Deep South Center for Environmental Justice as in a collaboration with them as an, I guess, a consultant trainer. I'm an OSHA outreach trainer as well. I do OSHA training throughout the state and work with various companies as well. Pretty much OSHA training, anything with OSHA, I do that on the side. General industry and construction, HAZWOPER, and variables of any other training, leadership, executive leadership, and things like that also. So I don't know how much Michelle wanted me to talk, but that's just a little bit about me. I do believe in, what we're doing here. This training is invaluable. A lot of people are misinformed out in communities. They're operating in the spirit of fear where they don't have to. They just have to use different precautions to better themselves. We've just lifted our mask mandate here in Louisiana also, but the thing is, just be diligent in taking care of yourself, and you should be okay. Being properly educated is very important in regards to your safety. So that's it for me, Michelle.
Okay, well, I
thank you for that opportunity.
The whole team. I know Kim couldn't be here, but it's just been a pleasure working with with both Bruce and Darian on this project, especially because, we're used to doing our HAZWOPER and all of that. Hazardous material and all of that kind of stuff, disaster preparedness, because that's the next area we'll be focusing on as well, because it's almost storm time again. And so we get geared up for that. But so now we're going to go ahead and address some of the questions that are in the chat box. And I would like all of you guys to be on board with that. So Bruce, were you monitoring them?
Yeah, I'm monitoring. I put some things in the chat already. I put the OSHA guidelines for worker safety, the coronavirus. Also,
you
put a link to the Massachusetts. They put a lot of information in on different entities, different types of workplaces, and the mitigation efforts they could take to reduce the risk. And that's what I want also to leave you guys with is this is about reducing the risk. There's going to be a risk at any level, but what we're doing is we're taking what's called a layered effect. Okay, we're taking a layered effect where we're not only getting vaccinated, but we also continue to wear face coverings, continue to wash our hands, continue to do our due diligence to remember we're still in the middle of a pandemic. And do not be fooled by numbers. Numbers have a way of eschewing the real information that's out there. We may be getting a lot of people vaccinated, but there are a lot of people in the world that is not vaccinated. You need to understand that we are in a global community and a global economy. We still have Americans flying back and forth to different countries where the different variants are and the infection rates are very high, and they're bringing that back into the United States. Do not fool yourself. It's either through commercial activity or through military activity. And people don't understand that. And that was one of the downfalls of the 1918 pandemic, is because we were in the midst of World War I, and people had forgotten that we had close quarters and people were being shipped from Europe to America and from America to Europe. And it's the same thing that's going on today. So we try to take the layer effect because we have a lot of other things that are working against us. We have technology, but we have a lot of people who are against the science. We have a lot of people who are anti-vaccinators. We have a lot of people who still believe that this thing is a hoax. You have a lot of people who are celebrities or in the political realm still believe that this is just foolishness or just the plain old flu and those particular things. So you have to be very aware of, you may be doing everything that you're supposed to do, but the person standing in line next to you may be doing nothing at all. So we have to take the same due diligence every day until this thing is eradicated by vaccination to get to herd immunity for the world. And we really have to do that. And then again, opening up, again, people thinking open means over, but open does not mean over. It just means it has more of a possibility and a higher risk of transmitting those infections to everyone. Because remember, a lot of people still won't exhibit signs. They'll be asymptomatic. They'll be fully infected, but they'll be asymptomatic. Again, I'm old enough to go through and remember the AIDS stuff. Can you tell anybody if they had AIDS or not? No. It's the same way with this disease. You can't look at anyone and say that they're infected or not. So guess what? We treat everybody like they're infected to protect not only them, but to protect yourself. So we have to take that type of position until not only America, but the world becomes fully vaccinated.
And I'd like to add something real quick, and Bruce, if that's okay.
Yeah.
You know, our generation and previous generation, we've consistently been exposed to some new virus or bacteria or something that has affected us. And to just take on practices in reference to dealing with one specific incident on a temporary basis does not protect us from future pandemic potentials. What I always tell my clients is really these practices should be adapted and continuous and make them a habit. Don't just do this temporarily just so that you can say you're following protocol or you're ready because you want to open up. And then as soon as things seem safe, you're going away from these practices that for the long term, I mean, even if it's not COVID, you can maintaining these practices can minimize the exposure of the flu virus that we have not eradicated, that kills millions of people yearly. Every year there are new strains that science has not yet been able to find protection from. And you know that if you take the flu vaccine, you know that the doctor or whoever's administering those vaccines constantly tell you that this does not guarantee you protection from certain strains that are now out. So adapting these practices and making it a part of your business protocol and process, I constantly urge my clients to make sure that this is an ongoing future, regardless of what virus have been eradicated, because there's new ones coming out every day and we can't see it, you can't smell it, you don't know how long it'll take before you become infected and what else you're being exposed to. So maintaining these practices and adapting equipments and processes and solutions that will consistently protect you is what I urge my customers to do, so that you are, protecting yourself from other liabilities consistently, both physical as well as legal and financial.
Thank you, Jennifer. That is exactly correct. I had a conversation with someone the other day, because people, just like every other regular person, they're seeing a lot more hand sanitizer and disinfectant and gloves and KN95s on the shelf. And then people say, well, they're not buying them, they're putting half price. Well, I say, well, they're not buying, but I'm still buying. Because guess what? It's going to happen again, because we had a PPE shortage when we had SARS, or we had the MERS, the Mid-Eastern Respiratory Syndrome. We had PPE shortage when we had the Ebola. We had PPE for Corona. Guess what? We're going to have another strain a year, maybe 2 years from now. And guess what? We're going to have another PPE shortage, but Bruce won't, because I have a closet full. It's called preparedness, emergency preparedness. Just like Jennifer said, this thing is not going away. It's just going to be named something differently, but it's the same type of infectious diseases and respiratory diseases, and we have to learn how to protect ourselves. And this is something that we must continue to do regardless. And just take from your great grandparents what lessons they learned from 1918. That I used to wonder why my grandfather always carried a handkerchief. And the reason why he carried a handkerchief is because he covered his face and his mouth and stuff with the possibility of sneezing. Why they always washed everything? Because they knew they had understanding that washing with soap killed whatever germs that they did not see. And we kind of went away from that in the chemical age and in the technology age, and it has caught up with us. And with double whammies with climate change and everything else, we have to be, food shortages, food prices going up. This is all a result of diseases that we have now, and food safety. My God, just realizing how many people getting sick on the floor that's packaging your food with the coronavirus. So you got to think about those things.
Right. And I thank you all. This information, like I said, is invaluable. And it's not just for the workplace, it's for the home place. I'm in the process of doing some trainings for some churches right now, because we want to disseminate this information because it is invaluable. And like Jennifer said, and Bruce reiterated, today we're using it for COVID, but if we have any kind of a disaster, you may have to use those same protective equipment. You may still need some masks, or you may still need, the wipes and all of those things. So we want you to get in the habit of, making sure you have your disaster kit. What does that look like? And all we have to do is look around and see the different things that are happening. That incident that happened in Texas a couple of months ago. I mean, who would have thought that, we talk about hell freezing over, but Texas actually froze over. So, we don't want to wait until we're in the midst of something before we start preparing for it. And so that's what this training is all about, getting you in the mindset of making sure that you have your business ready, that, what it looks like today, what it may look like tomorrow, and what it'll look like after some kind of a catastrophe, because that's where we usually lose businesses, when they have no continuity plan in place. So we just want to say thank you once again to all of you all for participating. Thank you, Bruce, Jennifer, Darian, for just agreeing to come together and collaborate on this project. So Melvin?
You do have a lot of questions.
We do have some more?
Yeah.
Okay, I'm not seeing them.
I put my email address in the chat. If anyone has any other questions that that they may have, if you send it to me, if I don't answer right away, still do not be discouraged. I will answer your email. Trust me, I will. One of the things was in the chat was about using of Clorox and other materials on hard surfaces. One of the things we forget is that those things were designed for temporary use, not constant use, because what's going to happen is you're going to build up a residue on that hard surface continuing to use Clorox. And you heard Michelle say earlier about occupational asthma or reaction to disinfectants or other materials being constantly used on surfaces and you touching those surfaces. It's always good if you got soap and water, always good. Soap and water first is at home, for hard surfaces, and then Clorox or some other disinfectant for a hard surface later on when it comes to that. Never use Clorox or other disinfectants for yourself. They're not meant for human consumption. No matter what some other people have said, they can cause people to die. Actually, we have documented cases of people dying because they ingested hand sanitizer. So do not do that or becoming overwhelmed with it. Do not try to make your own home hand sanitizers. They do not work very well because they can become very deadly, especially if you're using methanol. Methanol is a poison, and you have to have a certain amount of percentage of ethanol. So, you need to get in touch with people like Jennifer, those people who are required by law to have safety data sheets for their materials and know exactly what you need for safe consumer consumption, and those particular things. So, again, you heard Michelle, prepare for the worst, pray for the best. But again, it's going to happen again. I have no doubt. Just because we're human beings, we live close together, and we still have what they call wet markets. And I don't know if anybody will know what a wet market is. A wet market is where they actually slaughter animals when you pick the animal out in the market. So human beings are exposed to all sorts of diseases that can be transmitted from animals to human beings. So we're going to have those particular things. And then other countries do not have sanitation rules like we have. And then in our own country, we don't follow the sanitation rules. So you got to be very careful.
If anyone has any other pressing questions, we're open, so you can ask that question. You can unmute yourself and ask a question.
Michelle, if I can share something real quick.
Oh, go ahead.
I mentioned in reference to the masks, and I forgot to share this with everyone about, how to be able to provide masks for your staff and customers without exposing and contamination. We've had several universities and school districts who have ordered and inquired about our PPE vending machines. This is something that you can put at your place of business. You can charge for the masks or you can give it out for free, but we've designed them where they're convertible. So if at any point you decide that you do no longer want to have to offer masks, you can vend other products. And I'm just going to share that real quick just to give you guys a quick look at this. We can customize it for you. But again, the goal for our customers is to provide technology and products that make sense for the business. Not only can they make you money, but they can save you money and protect your company from going under because of something that you essentially cannot control. And you have to be able to take measures that are going to protect your business as well as those who are coming into your business. So this is just one of our vending station PPE vending machines that dispense masks, other PPE kits, and can be transferred into dispensing other products that make sense for your business. Thank you.
Did we have a question also before that? Someone with a question? And if not, Okay, Bruce has put his information. We've all put our information inside of the chat box. If you need to get
So
in
you
contact.
might want to remind them that they can copy the chat and all, some great info in there.
Okay, thank you. Yes.
Okay, so to Gwen's point, if you know how to save the chat, definitely don't forget to take advantage of that opportunity. You can actually save it to your computer. And then there's the copy paste option for those of you who don't have a Zoom account and you're not able to save. You have to have a Zoom account in order to save the chat. Some people are aware of that, some people are not.
Awesome. Well, thank you so much once again for all of you coming out on this Wednesday afternoon. We hope that we gave you some valuable information that you will now go and implement into your business, your home, your church, whatever, facility that it is that you're trying to accommodate, and that you will share the information as well, because we're all about protecting the community and making sure that we all are doing the right thing. So I'd like to say thank you. And Melvin, thank you for the opportunity once again.
Great job. Thank you, Mr. Bruce. Definitely appreciate your knowledge and wisdom today. And some of Michelle's other colleagues, thank you for coming to the ABC and delivering this very important information to us. Thank you.
No problem at all. Remember what Michelle also said, we're getting into hurricane season. So we also offer courses on hurricane and other disaster preparedness for workers and for workplaces. So there's something else that Michelle can do later on for you guys.
Excellent.
Okay. Thank you, guys. Thank you very much.
Have a great day.
All right,
Thank you so much.
Take care.
Bye-bye.
Thanks everybody for attending.